Hello, everyone. Good morning.
Good morning, everybody. Welcome to 1 Million Cups. We are so glad you could join us this morning. We've got a fantastic speaker today. We have Miss Tijuana White with Lor-raine Home Care Agency. So without further ado, we're going to turn it over to Tijuana, and she's going to tell us a little bit about her business. So it's all yours, Tijuana.
All right. Good morning, everyone, again. Happy hump day. We're almost at Friday. Like she was saying, my name is Tijuana White, and I am the owner and director here at Lor-raine Home Care. What we do, specialize in providing professional yet compassionate home care service to individuals here. Hold on a minute. I'm sorry about that. Yeah, to individuals here in Cumberland County, Robeson County, Harnett County, Bladen County, Lee County. I started back in January of 2020, right when the COVID was starting. I was opening my business. I met a little bit of challenge, but I kept going because I knew there was people out there who needed home care regardless of the pandemic. And luckily, I was blessed to keep it going. Everyone asked me, where did I get Lor-raine? Well, Lor-raine was my mother. She passed away 3 years ago to leukemia. And I wanted to do something in remembrance of her. She retired from the military and she became a CNA. And with myself, I was a CNA over 20 years here at Cape Fear Valley and Highsmith until I, went back to school and got my master's. Now I'm working on my doctoral. Area of service, like I said, that we serve is Cumberland County, and we get most of the people from right now. I'm in the process of branching out and doing marketing in Lumberton because we can go out as that far. We hire CNAs, personal care assistants. I have one RN on staff, and she used to do assessments when we go and visit the client. I myself, as the director, I make the first initial visit because so that way I can meet the client, feel the client's personality, that I can put them with the aid or PCA that they can relate with. Because I don't believe in putting someone into someone's home and they're both uncomfortable. Because number one, I don't want the client uncomfortable in their own home. So I try to really personalities together. But so far, I've done good, but sometimes I may have to go back twice and work it out. I'm very passionate about who I put with who, because I want both people happy and satisfied. And most of all, I want my staff experienced enough to take care of that client. We give our clients bathing, showering, light housekeeping, light meal preps, medication reminders. Now, we are considered non-medical home care, which means that we don't hire nurses to go out to do IV therapy or medications. We only do medication reminders. So that's the difference between home health care, and non-medical. Non-medical is more like home management. Okay. We also provide care for hospice clients. That was one of my passionate areas because of my mom, having cancer. That was one of my passionate areas where we do send out services to hospice clients. If they're on their last days, if the family calls and still want someone to come in, just to be make them more comfortable in helping them and still bathe them in the bed or just being there for comfort, reason, and support. We also do that. We do respite care because we keep in mind that caregiving can really be a toll on the caregiver at times, because we do understand that the caregiver still has personal personal life and things that has to be done on the outside of the home. They may have a problem with getting out because they have someone at home that they can't take out. They need someone to come in and be a respite care. So we do send in CNAs and PCAs, do respite care so that the caregiver can get out and do what they have to do during the day, come back home and not feel guilty they left their loved one at home. You know, just know they have somebody there that's compassionate enough and experienced enough to be there with their loved one while they're out. We do send our staff through a thorough criminal background check. It's most important. We don't put into the homes until that background check comes back. It's the criminal background check, where it's all over the state, where they check from North Carolina to New York, all over, to make sure there's no criminal background, there's no abuse, there's no drugs, you know, that the employee may have been on. We are really skeptical about hiring people with, you know, felonies or drug abuse in that way, anything like that, because we have to put the client first. We serve adolescent children as well, because some kids have attention deficit. They may have some type of illness or disability that the family, again, may need respite care for us to come in and take care of the child when they go to work or when they go out shopping or do what they have to do. I've learned that there's a lot of disabled kids in the area, the families not realizing that we as home care do service adolescents. Geriatrics, we serve disabled if they can still be at home, but they need someone to come in and help them around the house because they're in a wheelchair and they can't, you know, make their meals. We're there for them, you know, to help them with their ADLs. Dementia, Alzheimer's, we're there for them as well. When it comes to my dementia and Alzheimer's clients, I put my well-skilled CNAs in there, have dealt with dementia, because that takes a skill. You can't just put someone in there to take care of someone's loved one and they have dementia, because it's like the client is back to their childhood. So that PCL, that CNA, has to be experienced with dementia and Alzheimer's. Our pay methods, we always get asked that question. It's the first question we get asked when people call in for service. We do private pay. We do major insurance, private insurance. We take CAP DA, CAP C, Medicaid, and now they have the new Medicaid Advantage now. We also take Medicaid Advantage, United Healthcare, Carolina Complete, or Blue Cross Blue Shield. And we'll work those insurance companies for reimbursement. We do referrals from doctors. I do go out to doctor's office and get referrals, so that way they have clients that need help and they're not aware of what home care is available or what home care service is. I go out and I explain to them what home care service is and what we provide. Is there any questions so far? No questions? Okay.
I had a question.
Okay.
What percentage would you say is private care?
Care right now, I'm probably at maybe 10%, because we're in an area where most elderly people can afford private pay. So like I said, I'm at maybe 10% for as private. Any more questions so far before I keep going? Okay. We have started a transportation service as well, because you have people at home that can't get out. They need to go to CVS to get medications. They need to go to Walmart Food Line, get groceries, and they don't have the transportation because they can't no longer drive. They don't have family members here. So we started Lor-raine Transportation. And I have someone that's over Lor-raine Transportation. I'm going to let him take over and talk more about it to you about transportation. Okay. This is Mr. Gold.
Hi everyone, how you doing? My name is Mr. Gold. I also work here at Lor-raine Home Care. I run Lor-raine transportation portion of the company. Basically, we have a 7-passenger van where we cover Spring Lake, Fayetteville, Rayford, Hornet County. Basically, anywhere within a 40 to 50 mile radius we cover. What we charge is we charge $20 for there and back within a 20-mile radius of the office. So within a 20-mile radius of Lor-raine Home Care, we only charge $20 to go to your location and to pick you up and take you back home. $20 there and back. And we also accept Medicaid also for our customers who cannot afford to pay out of pocket. We also accept Medicaid and other major insurances. Just like I said, we have a 7-passenger van. Right now, I'm actually working on and looking for another passenger van that also includes wheelchair accessibility. I'm also looking into that right now. I'm also, my main goal is just to provide good transportation where people can depend on me and that people can depend on Lor-raine transportation to get to point A to point B on time. I realize how important doctor visits, dentist visits, even sometimes they just want to get out and go to Walmart or maybe want to go to the mall for a while. I understand that being out here in the world is very important to our older and elderly people. They want to still feel as if they are younger. They don't want to feel cramped into the house all day, and I get it. So I love helping people just like my mom. So the transportation portion is right on my alley because I can provide a service to people and see them smile and help them live a daily active life every day. Is there any questions, you guys? No questions? Okay. If I miss anything, just let me know.
I have one for you.
Basically, yes, ma'am.
You mentioned you do a flat rate of $20 to take them there and then pick them up.
Yes, ma'am.
Do you offer the service where, you know, sometimes when you do certain doctor visits, you have to have somebody stay there and wait?
Yes,
Do you
ma'am.
provide that service?
Yes, ma'am. We also provide stay and wait. Yes, ma'am.
And
It has to be within, as long as the service isn't within an hour. If the service within an hour, we will stay and wait for you. If it's over an hour, we will have to come back and pick you up.
And are you still charging a $20 rate?
Yes, ma'am. Same $20 rate. Yes, ma'am.
I would rethink that perhaps because your time is valuable and you need to factor the value of your time. So it may be like the just there and back is the $20, but if you wait with them, maybe there's an additional fee because your time is valuable.
Yes, ma'am. Yes, ma'am. You're absolutely correct. Yes, ma'am. And I will take that into consideration. Thank you so much.
I mean, I appreciate it's affordable because a lot of people at that stage in life don't have a lot of income, but you also have a business to run and you have a family to feed as well.
Absolutely. You're absolutely right, ma'am. I appreciate that. Yes, ma'am, Miss Cindy.
So with gas prices on the rise, do you anticipate an increase in that $20 flat rate fee?
Absolutely. We anticipate it, but right now, just because we're just starting out, we don't want to push a price point that's way too heavy for our consumers. So we're just watching, as right now, I'm just watching the time and watching the gas prices. And hopefully we get out of this slump of gas prices being so high. After a while, if we go through at least 2 months, I'm going to have to higher the prices, of course. Yes, ma'am.
Sarah also asked a good question. She wants to know about how you provide insurance for the service. How are you protecting yourself and your passengers?
Yes, we have liability insurance, and we also are working on passenger insurance for our customers. So we're fully covered. We're fully getting covered for all of our clients. Yes, ma'am.
And Dawn would like to know if it's 25 miles, how much should that be? How do you do it if it's over 20 miles?
Yes, ma'am. Anything over 20 miles, we charge $30. Anything over 40, we charge $40. Yes, ma'am. It goes up within the mileage. Anything over 20, we charge 30. Within 40, we charge 40 and up. Yes, ma'am.
Is that round trip or just one way?
That's round trip, ma'am.
Okay.
That's round trip there and back. Yes, ma'am.
Yeah, I have just one quick question. I don't know if you can answer it, if you have to pass it on, but are you guys bonded?
Are we bonded?
Bonded, yes, through the insurance.
Through the insurance, yes, sir.
Okay, thank you.
Yes, sir. No problem. Is there any more questions? I'm absolutely taking all of this into consideration. I mean, because this is good stuff right here. So I'm definitely going to take into consideration of maybe like Miss Cindy Burns said, hiring the price if I have to wait. So I'm definitely going to take that into consideration. Yes, ma'am.
I think it's a fantastic service you're offering because there are people at a certain age, or like we've talked about, that need a driver to a doctor's office visit. And that is so much needed that, you know, people just don't understand. I just think you have to watch your rates so that you're not going to end up losing money by offering this great service.
Yes, ma'am. Yes, ma'am. Absolutely. Thank you so much, Miss Cindy.
I've got a question for you.
Yes, sir.
Hey, great presentation so far.
Thank you, sir. I appreciate that. I get a little nervous when I talk in front of people.
I think we all do. Tell me about, do you have anything that you're running down to Hope Mills?
Yes, Hope Mills. We also cover Hope Mills. Yes, sir. And I'm also, I'm trying to get with some of the companies, Mountain. Because we also have elderly who still work. So who needs help to get back and forth to work. So I'm also trying to get with companies also and do that also.
Okay. Yeah, because have you looked at any other routes besides your existing routes that you have now?
No, sir. Not exactly. No, sir. Not yet.
Okay.
But if you have something to offer, I can give you my email and then we can go from there.
Now, you know, if you're covering Spring Lake and Hope Mills and then the Fayetteville area, that's really good because that's exactly where the demand is. You know, there's a huge need in the Hope Mills area for a bus system.
Okay.
But I think that is something that they've been discussing for a number of years. But I also know that, you know, the senior citizens and especially veterans are looking for transportation service. And it's becoming more and more and more sought after. So I think you're right on target. I think you got the right transportation. You just got to market it.
Yes, sir. Yes,
Yep.
sir. Thank you, sir. I appreciate you, sir.
Have you looked into potentially offering this kind of service, the transportation part? That one really intrigues me. To potentially parents of students with special needs, because
Yes.
if you could provide that, then allows the parent to get to work and you know, all of that good stuff.
Yes, ma'am. Absolutely. We also want to provide after school. If a parent would want us to pick up their child, special needs child after school or something like that, or take them to school in the morning, we also provide that. As I said before, my heart is big and my heart is into this business. I want to help people. I have a heart and I understand that my time is coming, and I want somebody to help me out, just like I want to help other people out. The next generation has to see us moving in a direction to help our elderly people. That way, every generation can fall behind. Okay, every generation knows to help the older generation out. So it's very important to me that I show I'm young, I'm only 30 years old, but it's very important that I show people my age and younger that we have to take care of people. That way we want to be taken care of when we get older. So we have to exude that before we ask for it when we get to that age.
And the vehicle you said you have now, is that one handicap accessible?
No, ma'am, not this one. Right now I'm actually working on it. I'm saving up my money and I'm going to go ahead and get that the wheelchair accessible one. But right now it's just a 7-passenger van right now.
Have you looked at grants? Because what you're doing, and you're a nonprofit, right?
No, we are not a nonprofit, man.
Okay, you're a for-profit. Okay.
Yes,
but
ma'am.
there might be grants out there. Sarah mentioned about donations. You might put something up there, you know, to see if anybody wants to donate, because
Okay,
it is
great.
a good, I mean, it's a very worthwhile thing that you're doing. But we do have some more questions in the chat that we need to go through. What somebody wanted to know that they do Uber and Lyft at times, and they make about $25 an hour of the hustle. But you got to remember your cost of your gas, and right now that is extremely expensive.
Yes.
So just don't underprice yourself.
Now, the kind of way that I kind of sell our business more than Uber is Uber doesn't wait for you. You have the option with us where I can sit and wait for you.
Right.
Some people, I've come to the realization that some people don't like being, especially older people, don't like being left at a location. And I understand and I get it. I get it. It's just not a feeling of safety. So if it makes the customer feel safer for me to stay there, yes, I will stay there with them. Whatever makes the customer feel more safe, because I never want to put a client in the position of them feeling uncomfortable or danger. So if I have a client that says, hey, Mr. Gold, I don't really feel comfortable staying at this location by myself, absolutely. We will work out a pay plan and work out how I can stay there and be of assistance.
And we all have somebody who wants to know if you allow somebody to come with them that's their emotional support person, or even an animal that's an emotional support animal. Do you allow that?
Yes, we do. And we also allow the aides to ride with their clients. Say we have a CNA that's with the client. We also, we encourage them to actually come with them. And if they have to go to a doctor's office, stay with them. We encourage that. Yes, ma'am. And if you do have animals that need to come on, yes. I would not deny that on my transportation.
All right, so how do you help those who are visually impaired and non-sighted customers? This person is a case manager and wants to know, or says that they very often have difficulty with transportation, but they want to stay independent. So how do you help that group?
Okay, if we have a client who is visually impaired, we would have to have I would have to know beforehand so I can have a CNA maybe there with me who can escort them around the property. To me, there's no in this business. Sorry guys, I can make it work. My whole thing is I want my clients to feel free and to know that just because of their age, there is no limits to what they can do. They can still go out and have fun, go shopping, do everything. If they're visually impaired, I will make sure I have someone there who will walk with them, escort them, make it work.
And Jessica wants to know, what do you do if one patient wants you to wait, but you're scheduled to pick up another? How do you handle that?
Another driver, ma'am. Another driver. I'm already in the process. I have 2 guys that I'm about to interview. They have vehicle driving experience. And as soon as we get up and running, the more vehicles I can have and the more drivers I can have to service more areas at the same time.
Well, Deborah pointed out, like we were talking, that Uber will wait, but drivers don't make money just sitting. So you're going to have to factor that in.
Yes, ma'am. Yes,
and
ma'am.
I think I missed an earlier question. Maureen wants to know, how are you spreading your name in your communities that you serve?
Well, currently it's just word of mouth, social media. I grew up here in Fayetteville. I graduated from Pine Forest High School, right on the north side of Fayetteville. So I grew up around here. So I'm known a lot around here. So word of mouth is traveling very fast. But I also know that I'm going to have to pick up radio promotion. We're going to have to pick up, we're going to be out here in the streets. I mean, I want to be out here getting the name out there, Lor-raine Transportation, to let the people know that I'm here for them. Right now, I'm waiting on flyers to come in. As soon as I get the flyers, my mom knows I like to be in the streets, talking to people, shaking hands, kissing babies. I like the people to see my face, see my enthusiasm. I'm a people person. So I just want to get out there with my flyers in different places.
And before I go spend a chunk of money on radio and things like that,
yes,
just take those flyers and go visit places like senior citizens centers, go to doctor's office that serve a lot of patients that are geriatric. There are a lot of things that you can do that's not going to cost you a bunch of money.
Yes,
like
ma'am.
you said, you got to go out there and hustle and give out those flyers. But I can imagine a doctor's office would love to make some referrals for you, or at least pass out your information, or have it, not necessarily pass out, but at least have it in their office.
Absolutely, ma'am. Yes, ma'am. Yes, ma'am. That's definitely a part of the plan to go to a couple nursing home, doctor offices, and let them know that we do have reliable transportation for them. Thank you so much, Miss Cindy.
And I think there's another place, somebody correct me if I got the name wrong. I think it's called like Better Health or something. There's an agency or organization in Cumberland County. Anybody know what I'm talking about? I think they're called Better Health.
I think I've heard of Better Health. I think I've heard of it.
But they do a lot of helping people as well. So if you can team up with that, like I said, go visit the senior citizens. Like I know there's a popular one in Hope Mills, but you know, that's where you're going to really, that's where the free advertising, if you will pay off.
Okay.
It's not going to cost you anything, but really your time on a lot of that. So let's go back to some of the more questions in the chat. We got lots of questions today, and that's great. There was an earlier one that I missed about, somebody asked, are most of your employees females, and do you match employees to clients based on their needs? I think that's more of a question for your partner.
Yes.
Okay, what was the question? I'm sorry, I didn't hear.
They want to know if most of your employees are female, and how do you match your clients and your employees?
Right now, most of my staff is female. I have 2 males. For some reason, I can't pull the male. Excuse me. I can't pull males in like I'm pulling females in. I don't know if it's the industry, they don't want to go in people's homes or what, but yes, I definitely need more men, and I'm definitely, marketing for more men to come in, because I do service VA, and most of VA are men. But you'd be surprised, most men client don't want men for some reason, I still want to have a good amount of men on staff, and I do match up personalities with personalities. As I was saying from the beginning, I don't want anyone unhappy in their own home, because like I tell my staff during orientation, this is their home. So when we go in their home, we have to respect their home. So when I take the first initiative and go out to meet the client, I'm looking and feeling that person's personality. And at the same time, I'm thinking, okay, this person be good with this CNA. This person be good with this CNA. So I really take that passionate, because I was my mom's caretaker. And I would not have wanted anyone or any agency to just put somebody in there for the money. Because I'm not in it for the money. I'm in it to take care of people. I serve first. Because as long as I serve first, then everything else will follow.
So we talked a lot about your partner's rate schedule. What's your rate schedule? Because you're offering a wide variety of services, from someone who can just come in and do some, being there when the caregiver needs a break, to doing housekeeping and meal prep. How do you schedule your rates?
My rates, I go from, when I do the assessment, I look at what the client needs. If I have a client that's total, that's in the bed, that can't do anything, that really need more hands-on, then yes, my price goes up. If I have a client that just need a companion, then of course they're not going to pay as much as the client that needs full care. That's how I determine, my price, and I have a price range.
I have a couple of questions,
Okay.
Tijuana. So with America's population aging, with about 17% of Americans being over 65, I can see where you have a huge demand for your service.
Yeah.
What are you doing? Today, trying to find qualified employees has become a challenge. What are you doing to recruit and retain your employees?
Well, number one, I only hire experience. My CNAs have to have 1 year experience. My PCAs, a companion, will have to have a 6-month experience. Okay, and I'm partnering up with a school, Cumberland Nursing Academy. I'm not sure if you heard of that, but it's off of Emily and I think Emily and Murchison. And I partnered up with her. She teaches nursing assistants, and I go out there sometime and I look at how they doing their skills, seeing what they're going through, for training. Because like I say, my client come first. I don't want to just put, somebody in there who don't have experience on how to transfer from a bed to a chair.
Right. So like the students that you're actually visiting, can you not let them job shadow, or let your experienced staff be their mentor so they can have that learning?
I have done that. I have done that as well. I have them go train with a more experienced CNA before I actually put them into a client's home. And then they also, when they hear the orientation, they also have a checkoff skill. The ones that are experienced, they still have to do a checkoff skill before they go into the home. So that way we know that you know what you're doing. We know.
And you also mentioned that you do non-medical care.
Right.
Have you thought about partnering with someone that can provide that medical component should the client need that?
No, not necessarily. I haven't thought about partnering with anyone as far as medical. And I think I think it gears more to me being so passionate about Lor-raine Home Care that I have to, and my ideas may be different from somebody else, because this is built from ground up. So if I do decide, and not to say I haven't thought about it, if I do decide to go that way, it's going to have to be somebody where we have the same ideas, the same compassionate, and and want the same thing, because I have to be careful on who I bring in, to help me build. So that's not something that I can say, okay, yeah, I want to do a partnership. That's something I'm really going to have to really think about.
So, and one last comment. I actually tried to visit your website and it's not working.
Put Lor-raine.care.
I did.
Yeah. I was just on it this morning.
Okay, I got it. I got it. Thank you.
You're welcome. Yeah, and I'm also starting a nursing pool. I'm going to staff nursing homes, assisted livings with staff. If they're short staff, and I have the staff, I'm sending the aide and the nurse into the nursing homes and assisted livings, because I'm finding out that's a really high demand as well. I'm just type person. I feel like we all have to work together to take care needs to be taken care of. It's a lot of people out here that needs care, and one agency can't do it all.
Well, someone wants to know, how big do you plan on getting your business? Do you plan on opening other locations when you grow?
Y'all reading my mind. Yes, I want to open one in Charlotte, and someone gave me an idea of, matter of fact, and this is my son. He's in the business as well. He gave me an idea of opening one in Lumberton. So that way I'm close and I have to go, so far as to Charlotte. So that's in my head. It's twirling in my head. So yes, I definitely do want to open another one.
Someone wants to know what's going to be your plan if you get really high demand for your services and you're running behind on your ability to hire people and fill those. Are you going to create any kind of wait list, or what are you going to do to handle that if your demand's greater than what you can supply?
No, I'm not going to do a wait list, because I would refer that client to another agency. I would not be that selfish to where I'm holding on to a client and I know a client needs help. But if I know I can't provide that service for a client, I will assist them in finding another agency. Any more questions? Y'all already give me some good ideas.
Someone also made the suggestion for the transportation side of things to look at scheduling and coordinating. So maybe you can do pick up multiple people at a time if they're kind of going in the same area, instead of doing a trip back and forth separately.
Yes.
We're currently working with a company now that does transportation scheduling, and we have a Zoom meeting with them, and they're going to show us how to keep track of the schedule. And this client, this client's going to take an hour in the store, and they don't mind being left there alone. You can go get someone else, take them to the doctor, and still, make that schedule, just kind of rotate it.
Basically, they're going to teach me how to work time, because of course, transportation is all about time management. So they're going to teach me how to work the time management, because that's one of the most important things when it comes to transportation, especially for the elder, knowing they have to get to doctor and dentist appointments on time. So that's very important to us. Like she said, we have a Zoom meeting with them, and I'm looking forward to see what they can teach me, because we're open. We have open minds, and I'm willing to learn as much as possible, and I'm willing to take constructive criticism. I'm a baby in this business. So what you're giving me right now, Miss Cindy, I'm working it. I'm working it.
Tawana,
Ma'am,
have you considered pulling in behavioral health? Reaching out to therapists and such as that to do even in-home type therapy or Zoom therapies with people that are in need?
with that, I think with that, your staff has to be licensed for behavioral health, because you can't just put a CNA with the behavioral.
No, I'm not referring to putting a CNA. I'm referring to actually partnering with therapists and such to do, and you be the one as far as in the scheduling of it. And also there's other opportunities out there. I think whenever Lori mentioned about partnering, that's not always meaning that you are going in business as far as you're bringing in another partner in your business. That means you're putting yourself out there to some of because this is being done on a very large scale, because my husband works for a company that is a national company, and they pull in people because he does in-home visits. He's a nurse practitioner. So he has his clientele that's in an underserved area, Harnett, Johnston County, such as that. But they actually provide services to individuals in the home by what you're doing. They have their social worker that reaches out to people that provide those types of services. I.e. like coming in the home or helping out with just cleaning or taking them places and such as that. So it might be that partnership might be where you're one of those contacts that they reach out to pull in to provide those services.
And something we do have that for us with hospice services.
Yeah, they do that as well, the hospice. So what I'm saying is it could be that there's other companies out there. They basically, to say the smaller scale, they work for the insurance company. It's kind of what they do. So they're that intermediary between the actual ER, the doctor's office, to save money, and they're seeing better care and such that's being given to the patients, that it's lessening the use of the emergency departments and such as that.
Okay. I'll look into that. Thank you for that one. Thank you for these ideas, y'all.
I had a question about your waiting. With Medicare and Medicaid, do they pay for waiting?
They pay for waiting?
Yeah.
No.
If they don't,
they just pay a straight fee.
Right.
And that's something that I've told Mr. Ty that we have to sit down and regroup on and think about, because if we continue to wait on clients that's Medicaid, we're not being reimbursed for that, then we're losing out. So that's something that we have to sit down and revamp. Definitely. Maybe putting time limit on, how long they have in Walmart, So yeah, and we're still working out some glitches, we've come a long way, but when we hit that wall, we always build another one.
Well, also, do you subcontract your billing out, or do you do it in-house? Do you hire?
I do it in-house. I have a CPA that does my bookkeeping, but as like
your insurance billing.
I do it in-house.
Okay.
Yeah.
Well, let me know if you need some interns, because that's the area that we have here at the college.
Oh, wow. Okay. Yeah. I feel like, I'm just starting out. I got to make sure I know where that money going, because I got to keep an eye on that. Be like these famous people be putting people into charge their money. They don't know what's going. So
what's your doctorate degree?
Keep a hold of this one right now.
What's your doctorate degree?
It's in healthcare administration. Yeah, I have my master's in healthcare administration, but I wanted to go up. I just love school. I don't know.
Love learning.
I love learning. I just love school. Yeah.
Somebody asked in the chat, why did you decide to go for-profit instead of nonprofit? What was your decision making?
I know I wanted to make money at the same time as give service. So, that put it on.
And someone else would like to know what type of license must need to open your business besides a standard business license?
What type of license?
Yeah, since you're in the home health area, did you have any other additional licensing that you had to get?
You breaking up, you breaking up a little bit. I'm sorry. Say it one more time. You goes on me.
Besides the standard business license, because of the nature of your business, were you required to get any additional licensing or anything else that you had to do besides standard business license?
Okay, yeah, you had froze up. I'm sorry. Can you repeat yourself? Yeah, it froze up.
Somebody would like to know, because of the type of business you're in, did you have to do anything other than a standard business license?
No, I just had to have the credentials of a bachelor's or master's myself and develop my policies and procedures and send those in and get my insurance and my workman's comp for employees. So some steps I had to do before getting the license, actually getting the license.
And do you train your new hires?
Yes, definitely. We go through an orientation. They go through a check off, go through background checks. They have education that they have to do yearly. Yeah, to stay educated. Definitely.
Well, I don't know if any people have additional questions, but I do want to, before somebody jumps in, I want to encourage you to stay around for a couple of minutes and make sure you read the chat. There were a lot of suggestions and things that we didn't get to. I was just trying to hit the questions that were being asked. There's a lot of stuff in the chat you'll want to stop and read.
Okay.
Other questions, anybody? Suggestions? Things that they can do? I would strongly encourage you, we're missing one of our usual people today. FTCC has a small business center, and as part of that small business center, they often have a lot of seminar and webinars that are absolutely free, as well as free business counseling, one-on-one counseling. And we would strongly encourage you to take advantage of that resource. I often will type in and post, as well as on their site, I will often put on the 1 Million Cups page the free webinars that are coming up. So take advantage of those. They're, it's free advice and free knowledge about business. So you can't go wrong with free, right?
Okay.
Other questions, comments, suggestions?
And I can give my email if anybody may think of questions later on that they want to ask. They're free to contact me and I'll give any information. That email is info@lorraine.care.
Hey, Lori, can you put that in the chat, please?
It's what now? Could you say that again?
Info, INFO. I'll put it in here in the chat.
Okay.
There we go.
Thank you, Belinda.
I have a quick question or maybe a suggestion, and I don't know if this was addressed because I had to step out for a little bit. Are you involved in any associations?
No, sir. No, sir. I've been looking through that to see where some good associations to involve with.
Yeah, I would highly recommend it. They have a lot of resources, can provide you with a ton of information. You get to know people who are in the industry. And I think that, man, too many people don't do that. And I got to tell you, it's an incredible resource that's incredibly inexpensive to belong to. So
Okay.
I would highly recommend that.
Okay. Thank you.
Do we have any further questions for Tijuana?
I may have missed this, but how long have you been doing this?
I've been in business 2 years, but I've been in the medical field over 20 years.
Okay, for 2 years.
Yeah.
All right. And you started with what, one van, and now you're growing to how many vans in
Well,
transportation?
I started with no vans because I started the home care first.
Yeah.
Now I'm starting the transportation. So right now we have the one van, and we're gonna put that up to the second. Want to get a second wheelchair accessible van.
Okay.
Yeah.
Yeah. How connected are you to the VA on Ramsey and over on
I have some social workers. I have spoke to the ones on Rayford Road.
Rayford Road, yeah.
That have spoken to, and I'm also I accept VA clients.
Okay. There's a tremendous amount of increase of service. That's the reason that's a market that's wide open.
Oh yeah. Yeah, we're definitely going to get out there. We're definitely going to get out there for, with that transportation and get market that out there with them.
Yeah. Mm-hmm.
Yep. It's luckily just this with COVID, well, not being as bad as it was. Now that people are starting to let us come in and stuff, so we're starting now to kind of get out there and start marketing like we should have been able to do 2 years ago. But that's a blessing. I'm glad to see that.
Well, if we don't have any further questions, Tijuana, I'm going to take the last question.
Okay.
What can this community do for you? How can we help you?
Help me promote. If you know of anyone that needs service, that don't know the way of going by finding it, please give them Lor-raine Home Care, and I will do my best to service them. And if I can't service them, then I'm going to refer them out to someone that I feel that can service them in a positive way.
Well, we want to thank you. It was a pleasure having you. We would love to invite you back. Come and tell us how it's going in the future.
Okay.
You guys, I appreciate your time. Thanks for coming out, supporting small business in our area. Next week, we're not going to have a 1MC next week, but we will return March the 16th. We have a local startup. We have Two Brothers Coffee that is going to come and tell us a little bit about their business. So I hope you guys will join us. You guys have a fantastic Wednesday. Enjoy the beautiful weather we have.
Yeah.
And we'll see you. Take care.
Thank you.
Bye.